Hi, I'm Shannon Dowler, Chief Medical Officer for North Carolina Medicaid. And like most family doctors, I wear a lot of different hats. And so today I want to talk to you about a few really exciting things happening with Medicaid. Greg wouldn't give me a real slot in the CME event, but he did give me the infomercial that I've got now. So there are two things I want you to know about that's happening in Medicaid that I worked all year to help make happen. And I'm so excited, and I think you will be too. The first is Medicaid covering for breast cancer and cervical cancer. Many of you are familiar and interact with the BSEP program, Breast Cancer and Cervical Cancer Prevention Program. Historically, if a woman wasn't enrolled in the program at the time they got their cancer diagnosis, they couldn't qualify for Medicaid, even if they met that income requirement. Because that they weren't enrolled in the BSEP program, they were excluded. Well, as of October 1st, we've changed that. So women who are enrolled in BSEP after their diagnosis of cancer, as long as they meet that federal poverty limit criteria that are established at under 250% of FPL, they now qualify for BSEP Medicaid, which is amazing. The next thing I want to talk to you about, and I'm going to spend a little more time on it because it's about STDs. So when I came into the program, one of the things I saw as an opportunity was to get better coverage for PrEP, pre-exposure prophylaxis for HIV. How are we doing in North Carolina with HIV prevention? If we had time for a polling question, I would put this question up here. Bad news is we're doing really badly. So what could we do using our Medicaid lever to improve it? North Carolina leads the country in STDs. You've heard me talk about that before, haven't you? Chlamydia, gonorrhea, syphilis. And when you look at HIV, the eastern part of our state particularly is disproportionately affected by HIV infection. Who has HIV in North Carolina? People living with it are usually African American males. They're older if they're living with it, but if they're newly diagnosed, like this graph shows, they're young. They're these 13 to 34-year-old males. When we look at the PrEP to need ratio, this is a ratio that looks at the amount of PrEP being prescribed in a state compared to what they see as the need based on the rates of HIV infection. North Carolina consistently prescribes below 50% of everybody else. The higher the number, the better. So the rest of the country is chugging along at almost 5 ratio. We're down at 2.8. So we really could do better, North Carolina. So I thought, what could we do? How could we help folks do more PrEP coverage? One of the challenges is a lot of young men aren't covered by Medicaid because we haven't expanded in North Carolina. So what about our family planning Medicaid? So we looked at who's using family planning Medicaid, and it's obviously mostly women. So how could we get the men covered so that they could get PrEP covered? We decided to look at our family planning Medicaid coverage and make some broad changes. So you'll see it's not just PrEP that we worked into this coverage now. We've added important things like the NAT test for trichomonas. You can now test for Mycoplasma genitalium for appropriate patients. You can pay for the Kyleena IUD, all sorts of fun things. But the most important thing is we created a way for when men apply for and qualify for family planning Medicaid, we'll cover the chemistry that's needed to monitor for PrEP. It covers for a comprehensive physical and 6 visits a year in your office. It covers all the STD testing that need to be done, with the exception of hepatitis B, which is a state-covered service. So you have to meet the criteria for being high risk, which by definition, if you're getting PrEP, you're high risk. So all that's now covered. So for clinics to provide PrEP to young men, as long as they're enrolled in family planning Medicaid, this actually becomes a positive ROI. What do you have to do? You got to talk the young men into applying for family planning Medicaid. You've got to get the drug through a medication assistance program or through the HRSA benefit. And you've got to use the state lab for hepatitis B testing. There are folks around the state doing this really well. And now I've made it so that all of you can do it really well. I can't wait to see our ratio of PrEP to need next year. And I hope we're catching up with the rest of the country.